Hi, everyone. First of all, thank you for inviting me. It's a pleasure to present today. I have been listening to some of the previous speakers, great presentations, great research programs. So it's a great pleasure and honor to be presenting today. Sorry, I live in Canada. It's night for us. My name is Rozita Dara. I'm a faculty at the School of Computer Science, University of Guelph. I'm an associate professor in our school. I also serve as data strategy director with, which is in a department which is between University of Guelph and Ontario Minister of Agriculture and Agri-Food. And then my role over there is to manage our research station data. So building platforms, ensuring security, ensuring data standards, the data we collect from livestock research stations, as well as crop. But the topic that I want to talk to you today is on the use of social media and other online data for detection of infectious diseases. So you may wonder, I have quite a diverse background. So I worked at BlackBerry. I assume everybody knows what BlackBerry now is still. It was the first handheld device that was made basically with something familiar, basically these handheld devices that we currently have, mobile devices, smartphones. I worked there as a research scientist, and I worked on building mobile health platforms. Then for a year and a half, I worked at the Office of Information Privacy Commissioner's office, Ontario province. So over there, I became familiar with some of the legal and process and practical challenges of the new emerging technologies. But my background, I got my PhD at the University of Waterloo. When I came to University of Guelph, I built an interdisciplinary research program in the area of data management and privacy governance. But being at the University of Guelph, because it's the food university of Canada, I started applying my research to agriculture. The two major themes that I have in my research program, immediately because I had extensive experience working on traceability platforms, mostly for software, but also building decision support system for decision making. One of the early projects that I showed interest, and it has been quite successful, was on disease modeling using decision support systems. But I also have another stream of research, another theme of research in my program, which is focused on governance of agriculture data. And governance, its security, privacy, data quality, and all those aspects. So I don't know why, because something has happened here. So sorry. So I just want to talk about the infectious disease modeling more specifically. So again, as I mentioned before, I have extensive experience in building decision support systems in different applications, but to some extent, the concepts are quite similar. So you identify the data sources and basically relevant data sources based on research, interviewing subject matter experts, then looking at the existing data sources, looking at collecting new data from different sources, and you kind of bring all that information with the knowledge bases that exist into something that would be meaningful for decision making. So basically, one of my first projects was on avian influenza outbreak modeling. So I'm a computer scientist. I had to collaborate with my colleagues, epidemiologists and also immunologists who are expert in this area. We recruited a few graduate students, and they started looking into the problem. So the first resource that we looked at was obviously scientific resources, some of the existing guidelines, and best practices that epidemiologists and immunologists look at for control of avian influenza. Avian influenza, as you may be aware, is a reportable disease. It's not only it impacts animal, it also impacts human. If it becomes adaptable to human body, it could be the impact that it has. It could be way more sophisticated and dangerous than COVID-19. So basically, all countries and nations take it extremely seriously. So we looked at the papers and also, again, best practices that was on the type of data that was being collected to control avian influenza or predict avian influenza, which is the hardest part, or evaluate the risk factors. We also identified different data sources for detection of that would be relevant to avian influenza. Then we had to build the knowledge bases and take the additional steps to build our decision support system. But a general overview of decision support system is as follows. So finding resources, guidelines that would give us some information about how disease can be modeled, evaluated, predicted, or maybe potentially give us a recommendation on what the mitigation strategies are, basically control measures. Then there are other data sources that currently available. They are either private data sources or public data sources, which I will talk about, but basically knowledge bases, whatever exists needs to be investigated. Once that is investigated, so let me go, that was my concern, a little bit, sorry, that it would, so let me have all my knowledge decision support system up. So basically what the first step is, first of all, we get the data and we have to pre-process and integrate that information from different sources that come in. So it could be in text format, image format, or it could be categorical data, numerical data. So that data needs to be collected, then integrated, analyzed, patterns needs to be extracted. Also, we have a knowledge base that will help us with the decisions that are made when it comes to a disease. Those knowledge bases, if you are lucky, they are collected in a kind of clean and usable, machine-readable manner, such as taxonomies and ontologies, or we have to create our own knowledge base, which we had to do it for avian influenza. And also our collaboration with this diverse group of experts would help us to build this knowledge base. So basically getting that information, identifying pattern and classification results, classes and everything, we were able to then, that information can be fed into kind of a use of basically that information into ranking, based on maybe severity, being able to write meaningful queries and get results aggregated in terms of for decision making. It could also help integrate different information that comes from different sources and put it on a dashboard. So basically, we get all that information and kind of group them and format them in a way that the subject matter expert can make decisions. So there is always a user interface in the decision support system and the experts who are sitting on the other side who can write queries. Again, when you write queries, it goes back to the database, to the integrated database, maybe not to the raw database, but to the integrated database. Or it would be queries that will be written, but that again could go to different layers and extract the information that's needed. In all we do basically, if it is avian influenza, still some anonymization may be required. But if we work with very sensitive data, obviously anonymization and being cognizant about the privacy and confidentiality is important, but also governance. So we have to make sure that the quality of data is important, using standards and interoperable best practices that ensures interoperability is important, protocols and ethical considerations around the data we are collecting and the policies. So building a decision support system is an extensive effort. If it is done well, it's quite rewarding because it helps with decision making. but there are many different aspects that needs to be considered. Once we have a decision support system, there are different categories of decisions. So sometimes we analyze data to discover, just to know what happened, and also be able to describe what happened, discover them, certain patterns. Maybe there's an outbreak, maybe some activities that seem suspicious, especially when it comes to infectious disease outbreak. And also, if we have the data and we are storing historical data, it can enable us to predict, to describe. What makes it more interesting, and this is extremely challenging when it comes to infectious disease because risk factors are still, we are not 100% sure that what the risk factors for some of the diseases are, what contributes to those risk factors, which ones are more important than the other ones. But it would be great if we can predict if, for example, if there's an outbreak in a region, even if it is for early outbreak detection, so that so that we can start planning. That would be quite valuable, and I think we all relate at the time of COVID and what happened. And also going one step further to be able to prescribe control measures, which is I don't believe, at least for some of the infectious diseases, we are there yet. So as I mentioned, one of our early research project case studies was avian influenza. Again, just because I'm at the University of Guelph, I have access to experts. I have access to the expertise that I could use to build this decision support system. So we identified, just very quickly, different sources of data: social media, farm level data, spatial temporal kind of surveillance data. Social media, obviously, we started with Twitter. Then for farm level data, we were hoping, just get a little bit more specific data, which was hard, and we had to drop that part about specific farms, maybe movement between farms and all of that. With COVID-19, we were distance measuring, measures were important, so we had to distance from others. So same thing for animals, and also many other data sources, weather, wild bird pathways, and for spatial temporal data. So we collected all those data sources, we analyzed all of them separately, made an attempt based on existing research to integrate them. And then we couldn't access farm level we couldn't do farm level. We could have simulated it, but we couldn't get access to real data. Then we could build a kind of a decision expert system level to say, based on this risk factor and magnitude of what that data represent, and also based on past studies of contribution of weather and wild bird migration, and all of those then come to a conclusion that whether within a region in the next week or two, first of all, for early detection, something is going on, that the data is representing something that we need to investigate, or the magnitude of an outbreak. So that was, we were hoping to be able to predict the magnitude of an outbreak, which turned out to be a very extremely hard job. But anyway, so we built, we kind of had a knowledge base of all this different information, metadata, taxonomy that we had to build. Then we had to look into extracting data from Twitter and what it represents, and getting some indicators from Twitter. Spatial temporal data, we had an analysis of whether weather, wild bird migration, density of the farm, which ones were more impactful. Then with that, we also did a preliminary kind of investigation on what type of questions would be interesting to ask. And then we were basically able to just, build a map to say, okay, these areas are safe. The darker it gets, there's a higher potential to have an outbreak based on the data we receive, based on the data and our analysis. So a dashboard for a kind of emergency responder to just go there, input the information, and see some sort of a result. So right now, most avian influenza outbreak reporting systems, this is USDA, are descriptive. So going to the extent of prediction, this seems to be an extremely, so we were, as a computer scientist, I was just hoping I'll predict it, all sorts of things. So we have to be very cautious, because It depends, risk factors, evaluating risk factors, magnitude of those risks depends on a number of factors. So we have to be careful with prediction. But describing the situation based on social media and all of that would be reasonable, something that can be done, especially for reportable disease when there is an organization that has very clean data. So what happened with the use of social media for avian influenza? The result was very promising because we collected our data in 2017. We didn't think farmers or farm organizations will be, using Twitter data much. But it turned out to be the other way around. The results were, as I mentioned, were quite promising. And then we think right now it would be even, the result could be more impactful or could be more accurate, given that most organizations, farm organizations, even farmers, given that the generation is changing, maybe tweeting or using social media. But what we did, we collected, obviously, with the experts we had, we collected sample data, we reviewed them manually, we selected the best keywords. So that was the approach we have taken for all of our research. Then we went back and put a, kind of a query in place. We paid for Twitter and collected the data, historical data from Twitter, to just see whether Twitter would be, or as an example of social media, would be able to help us to predict avian influenza in different regions. So obviously unfortunately at the end, we were limited to the data and location of the location that was associated with the tweets that we collected. Then we had to, obviously we collected, as you can imagine, Twitter data on any topic. There could be lots of irrelevant tweets. So we went through the effort to just, we annotated 5,000, again, with the subject matter expert, with 2 of them that we had, and their students, to relevant and irrelevant, relevant to avian influenza and irrelevant to the subject. So we used that initial set to use semi-supervised learning. Semi-supervised learning are methods that you have no or very limited labeled data, but with that information, you are able to annotate additional labeled data. And we had over 208,000 tweets for avian influenza. So, so we only had 5,000 annotated. So we used that 5,000 to just get rid of very obvious irrelevant tweets that we had collected. And once we collected relevant data, we assumed, and the accuracy was close to 80% with using, we tried different algorithms, naive Bayes, K-nearest neighbor, deep learning. So the highest accuracy that we received, and we also, my students had quickly went quickly over some of the tweets. The results seem quite reasonable. So then we use anomaly detection to be able to to better understand whether, first of all, Twitter data could represent an outbreak, based on the discussion on Twitter, and also in a certain region, whether it was able to help us detect it earlier. Because as you know, by the time an outbreak is reported, especially when it comes to livestock, it could be a few days, it could be a few weeks. Usually, hopefully it's few days. So we were expecting there will be a lag between the time that data is officially reported and Twitter activity. Although we looked at the time of, so some of these disease reporting systems have confirmed the data that an outbreak has been confirmed and that the outbreak was reported. So we use reported date, but even for that, we believe there may be a few days of lag. So basically, with use of the semi-supervised learning and also anomaly detection, we looked at different regions, Saudi Arabia and many other countries. So the result was promising. So basically, I have 70% of real-world outbreak notifications of, and by AI, this is avian influenza, just to save space. I put AI were identifiable from Twitter. So 1/3 of the outbreak notifications were reported 1 to 2 weeks earlier. And again, this is 2017, and this is for avian influenza. So it wasn't for human kind of infectious disease outbreak. So we use semi-supervised learning and improved the number of relevant data that we received. We repeated that several times. And with that, we were able to, again, receive promising results. So this, the one that you're seeing on this slide is from Saudi Arabia. So our paper is available online, so you can have a look. So this was quite a promising result. Then we did we weren't expecting, to be honest with you, this to Twitter to show this type of results for avian influenza. Again, this was more expected for human influenza or infectious disease. But basically, with that promising result from Twitter, we went and look at other factors when it came for avian influenza. We look at other studies. We combine social, spatial temporal data, and basically put on the map that I showed you. So we use Twitter as a weak indicator. So it's not a strong indicator, as you can imagine, because of the misinformation and also some biases because of the language that we use, the approach, the keywords and all of that. So basically we broke down, we did weekly analysis, and then so we defined a certain regions with cells, and then associated Twitter data, a case, number of cases. So we collected that data from OIE, which is a WHO database, which we assume would be quite reliable. We looked at weather data, the wild bird migration path, which is a project that is basically everybody can report the type of bird they have seen, and that database would categorize them. Experts would categorize them, and they can say in what region they have been viewed. So it's a citizen science project. We collected, they gave us permission for the project to get access to that information. Basically, we extracted rules. We looked at patterns of past historical outbreaks and all that information. And there were basically certain, kind of patterns that we have observed. For example, disease presence and chicken and duck densities. There were positive correlation between that and avian influenza outbreak and other kind of patterns. So I will go later on and I say, so every disease and every outbreak can have their own behavior. So especially when it comes to social media, because social media depends on human sentiment. And for example, for recent avian influenza outbreaks, we were collecting with the same keywords. We are currently collecting with the same keywords, but we were informed that the recent outbreaks in the past year and a half is more related. In the past, it could have been related to movement between farms as it was spreading. The spread was because of the movement between farms, but they say this time, although there were kind of quarantine imposed on many farms, they couldn't control it. The feeling is it could be related to wild bird presence. So we had to change our keywords for Twitter data extraction and put different name of different wild birds to be able to make sure we are collecting all the right data. So quickly moving forward to COVID-19. When COVID-19 happened, we thought, okay, we have this idea, we have this successful project, could we implement it with COVID? The problem was that we couldn't, mainly because of, for many different reasons. So obviously, if we could predict the outbreak in a region, would have been interesting. Analyzing risk factor would have been interesting. But the problem was we didn't have access to data. So we wanted to collect similar, so at least a number of cases was easy. Social media was easy, but all other type of data we wanted to collect, for example, global network of air travel, too expensive. We were told for 1 year during COVID, which would be $60,000. A network of people moving between cities. I'm not sure how reliable the data source we found was, but they said it's 10,000 for half a year or something like that. And so again, hospital records, obviously, no, I think we have to go through a long process to get that information from public health. I think some data could be possible, but it's a long process. We wanted to have results immediately. So we had to narrow down our work to social media and the number of cases, so that was the data we had. So we thought, okay, if this is all the data we have, what can we do with it? And then we started publishing on different topics. First of all, could we replicate the successful prediction capability of Twitter for COVID-19? Predictive and descriptive, but prediction was more of our interest. A sentiment analysis of how do people think about control measures, especially vaccines, and all the misinformation about those type of vaccines. So then we thought, can we look at the demographic of people who are posting it, kind of linking it back to misinformation and kind of reliable information, or we ignored, we considered misinformation to be the threat. And then we looked at how people, view perspective on public health leaders. The other thing we were wondering about, could we provide recommendations to public health authorities based on our research? So this time we used Google Trend as well. So in the case of the previous study, we didn't. But for COVID-19, we thought people may just do a search on their symptom, and it could be a reliable source. We also looked at using social media, because as we were doing this, for foodborne illness prediction using social media. So that was, if I have time, I'll quickly just touch on, because some of those papers are currently under review. So again, same process as I mentioned to you before, collecting tweets. Obviously, we had to go, there were lots of irrelevant tweets, so we had to get rid of those. Number of cases, it was being reported almost everywhere. And Google Trends, we looked at, we again worked with the subject matter experts, this time in public health as well, to identify important keywords, and then use those keywords with Twitter, use those keywords with Google Trend, extracted data, cleaned that up, and did anomaly detection. In some cases, because the wave of COVID got to different states, especially in US, at different times, our focus was only North America. We had to divide it into first wave, second wave, some provinces or states that were affected in the beginning immediately, some were affected after. So for these projects, as I told you, the list that I showed you, we realized, because of the amount of tweets that were being generated, it would be best if we just focus on, for example, if it was the public perspective on control measures, we just put the keywords for those control measures, because first time I think we collected over 9 million tweets. And we thought, okay, this is good, but it's too much, so, and it's just all over the place. So we went back and put other queries in just to make sure the data we are getting is slightly more accurate. So were we able to predict first wave of COVID? Yes, we were. In Canada, 83% of cases we were able to predict it for the first wave in Canada. In US, it was 100%. US got it a little bit later than Canada, so I think people were more aware of it. They were typing, or they were tweeting, or everybody was scared, so many organizations were tweeting. Second wave was a little bit tricky. For example, first of all, also it really mattered whether the province or state was impacted major, that significantly by COVID or not. So that was also a contributing factor. So we showed that in our study, which I will show later. Basically, social media mimics our worries to some extent. It could be misinformation as well, but also mimics news, mimics what's happening in public, in people's mind. So that was something we wanted to test. So basically that's what it does. For some provinces or states that weren't majorly impacted, that prediction ability was slightly weaker than the other ones. Yeah, so for category, so again, some of the provinces, the first wave, so we had two categories of states in US that were impacted by the first wave, or some of them a little bit later, which was closer to the second wave, they got their first wave. So again, first wave was much easier to predict. And then the second wave was harder, or in some cases almost impossible. So I think it was because of the COVID fatigue and social media fatigue. People didn't want to tweet it online. So another case study looking at the sentiment. For sentiment, our approach was slightly different. So we had to look at exactly the question that we had in mind, and sometimes we had to look at certain keywords. Sometimes we have to look existing packages, for example, positive and negative tweets. When we looked at positive and negative towards vaccine, we were using some existing tools. We could do annotation as well, and then maybe that would have been more accurate, but because we had so many different, kind of ideas that if we wanted to test, it would have been very time consuming to annotate, 5 to 10,000 tweets. We did that for misinformation, and we spent quite a bit of time on annotating that data, but and it was very rewarding at the end, but we didn't do that for all of our research. So in one study, the focus was on understanding sentiments, kind of engagement on Twitter. So we collected a different set of data based on different set of keywords. In another one, for example, we wanted to know people's perception on public health authorities and politicians. We went to their Twitter accounts and collected all that data. So approach towards the data collection was different. And then the analysis approach was different because did we focus on keywords? Did we focus on positive and negative keyword? Did we focus on vaccine, for example, only? Then we had to extract tweets related to vaccine and look at the positive and negative. So again, these were 3 different studies and 3 different sets of results. Approaches were slightly different from one to the other, but the idea is the same. You get the Twitter data, you do keyword analysis, and then you have to think about the question, and the queries that you put has to be aligned with that. So what did we find? Yes, people, perspective, news will make it to the social media. So every peak over here, we were able to associate it with a big event, or maybe announcement, or misinformation, or positive information about vaccine. It was able to mimic it. Overall, positive tweets were generally a little bit more than negative tweets. So we kind of got rid of neutral tweets. So we didn't put it here, but if you would have added that, it would have been obviously negative, positive and neutral comments were much higher. So again, over here, we are able to identify, to see that some of these vaccines also, the type of misinformation that was associated to them generate a little bit more discussion on Twitter. And then anti-vaccine activities was less than, was at some point, especially this pick is related to Pfizer. It had a pick, but there were many people who were hesitant. We call them they were hesitant towards vaccination. So what had constituted showed that some people who are hesitant are pro-vaccine or anti-vaccine. We have captured all of that in our data, in our paper. At the end, we were able to also make recommendation based on what we have observed. Can we detect, we can easily detect, if we have a paper under review, we can detect bots. We were able to detect them, and that was that was shown in other papers as well. So bots were the ones that were generating lots of misinformation. So public health can do the same. They can monitor social media. They can maybe, with the work of other public health agencies, they can work on kind of promoting positive message to public. They can detect bots, they can report them, so they can collaborate with researchers and the social media platforms to discard misinformation. I think that is already happening. So there are lots of things that public health can do. One more example, which again is of using social media. Some of them are infectious disease, some of them aren't foodborne illnesses, but generally speaking, because this paper is under review, I cannot show the results. But this one was interesting. We looked at Twitter, Yelp data, Google search score, and then obviously we had to get actual public health data, which took us 8 months to get that data. So, and then we had to clean it, very similar to the relevant and irrelevant. We had to separate them. We had to look at the keyword for each foodborne illness separately. Again, we had another subject matter expert on a group of them working with us to identify relevant keywords and identify relevant symptoms, because with each foodborne outbreak, there are different set of keywords. So interestingly, and I think to some extent it makes sense, Google search score was the most representative, or it was able to better predict foodborne outbreak. That's because we consult with Dr. Google. We ask questions when we are not feeling well. It's less likely that we would, it's not like COVID that would go and say, oh, by the way, I have this, I feel this way, or in our region, that's the problem, so maybe a region, maybe it's a major outbreak. It makes it to the Twitter, but we don't personally report that. But Google Trend search scores, they're shown to be the most reliable. And so Yelp, not as much as we thought originally it would be. And some illnesses, because of the magnitude of outbreak, it was easier to detect. And some of the illnesses, if they had very unique symptom, again, it was easier to detect. And the other thing about this particular type of illnesses is that the type of keyword that we use, usually people, the slang they use and the scientific words are quite different. So we have to understand what people tweet about. So basically that's I started with decision support system because I wanted to say that was our motivation. And we were curious whether Twitter can be used for this purpose, for detecting illnesses, especially infectious disease. And the answer was yes. But there are obviously many limitations focusing on English. So we have used the Twitter package that can translate, but still how reliable that is. Many countries, they have their own platforms, such as China and other ones. So we are not collecting data from all, so our data may not be as representative. The issue around misinformation, obviously it will remain a major challenge. The issue around, for each disease, there are certain type of relevant keywords. Example I gave you about avian influenza, in our past research, we didn't specifically mention the wild bird, but based on the information we received about the characteristics of a current outbreak of avian influenza, we added those to our search. And shorebird were the ones that represented more than the other wild birds. So we added that. So the overall approach using, collecting data, cleaning that up, using semi-supervised learning to divide to relevant and irrelevant, those are general approaches, or identifying keywords, working with the subject matter experts. This is an iterative process. It doesn't happen once. It doesn't perfect once. So you have to go through several steps. So those are generic approaches to tackling the social media, especially sharing the data. For example, we have an annotated 10,000 for misinformation for COVID. So sharing that type of data with each other, because having annotated data will make the result of analysis more accurate. And so those could be significant contributions, and making sure that we can use social media effectively. We haven't looked at other social media platforms. That could be an interesting also research. So at the end, we have to make sure that the effort that we do make would be helpful to the policymakers, decision makers, emergency responders. So there is quite a bit of a hesitancy in terms of how reliable is social media. So engaging the decision makers, the end users, and this is something we are currently doing to just understand what exactly from social media should be extracted. Is it a kind of a weak indicator of an outbreak? Maybe that's the solution, and maybe that's the way. Maybe it's the sentiment, people how people express it. Maybe that could help. So, but that's still an area we need to work on to make social media more useful. What was interesting? Yes, social media mimics our behavior. It can be used to predict disease. It was showing kind of suspicious activities ahead of the time before public is aware, or before even diseases are reported based on the databases we were using. So all of those are interesting and very promising. But in terms of exactly how we can use that information, then still that's and what would be the most reliable way of using that information, so we are not misled by social media. That's something we still need to work on. Thank you very much for listening, and my apologies because I couldn't see the time, so I don't know how much I have been over, but yeah.
Oh, that's fine. Yeah, we still got some time for like questions.
Okay, thank you.
Thank you. Like it's a very enlightening topic. Any questions from the audience? Yeah, we don't have.
I just have one question. Thank you. That was a really good talk. I was just curious, not so much about the misinformation side, but thinking about moving forward, like a lot of those analyses were done during the COVID waves. But moving forward, I think there'll be a lot more interaction between flu and COVID with them both co-circulating. So, and I'm assuming the keywords for those would be very similar, right? Because there's a lot of crossover in symptoms. So how do you see any way to separate those out? Or do you think more long-term it could just be respiratory illnesses? Or do you think you'll be able to differentiate between COVID and flu?
COVID and flu and influenza, to be honest with you, so that I cannot say 100%, but I would say, because the way we extracted keywords was general COVID-19, coronavirus, so those, I told you, it resulted in 9 million just in a matter of few days. So that was a lot of data to deal with. Once we got into the symptoms and control measures, those were very specific. But still, symptoms for flu and influenza and COVID, they're quite similar. So there is so much that we can do with these keywords. So if they are similar, we cannot distinguish them. Overall, we can say, so maybe we can look at other sources of information. For example, cases that are being reported and we know 100% they were COVID. Then we can associate that information with the region and Twitter with the region, and then make some conclusions there. So I think it would be hard. As I told you, for foodborne illnesses, not all the keywords, although they were symptoms of that, for example, Salmonella, E. coli, they were representative. Not all of them were as representative. There was always one keyword that would stand out. And it's just when we talked to the subject matter expert, they said, yeah, that's very representative of that outbreak. So that's unfortunately the limitation that the social media has. Yeah, so that's, and one more thing, Twitter doesn't always give the region information, which is another problem. Google Trend does. So in some ways, it's a little bit more reliable in that sense. Yeah.
Excellent. Thank you.
Yeah. Any more questions from the audience? Yeah, I've got one, like in terms of moving forward with the labeled data, like in future, because like, do you think like how reliable would that be? Like, because there will be change of user behaviors, and then like maybe in the next couple of years there may be changes in the user behavior. So like the algorithms that you have used, the training, validation, and how reliable would that?
In terms of, so we human, we express some of our opinion similarly. For example, if it is towards, let's say there will be another outbreak and there will be another vaccine hesitation or misinformation going on, the way we express negative view of positive view in terms of some of the keywords that we are using, it's quite consistent. So that has been studied for quite a long time. There are keywords that are specified to positive, negative, and in between. So I think some of this data, labeled data, could be useful in some cases. But if it is very specific, for example, we did a study on this type of vaccine and what kind of misinformation was associated to it. So in one of our papers, which is published, so they said what was it, Pfizer, there's a chip in it, and so those are very specific to the disease. But it's important. So also with deep learning, I guess, I'm not sure if that's an idea, but with deep learning, as you know, transfer learning, you just feed the data from different, so maybe we can feed misinformation and correct information about all type of diseases and see if there will be in the future a deep learning network that can identify misinformation on its own. Is that an idea? I really don't know, because but I think that we have to have the right tools in place when something happens, especially for public health, because public health at the time, they understand the context, they understand the related information, they can constantly monitor, see which account in one of our research, which is already almost accepted. We showed, and this has been confirmed by other research, bots, Twitter bots or social media bots could be identified because of the massive information they send out and the kind of frequency. So those could be, they could work with the social media providers to block it. They can look at the public worry and then put a positive word out. So I think that type of a use is not going to go away, and it's just few NLP, machine learning algorithms that you can annotate data, feed it. Not even annotated, because these semi-supervised models, they work with without labeled data. How reliable that is, again, depends on the data and the context. And yeah, so that could be something that public health can always do. So we did a research on public's perspective about politicians, male and female. So we found some general some patterns that was consistent with the past. For example, they trusted the female a little bit more than the public health authorities, or kind of they were a little bit hard on politicians versus kind of healthcare authorities. So maybe politicians can use it to their benefit as well. So in the future, the language that they put, it's a little bit more caring, and just instead of just making certain decisions and policies, at least the way they express it. So there, I think social media could be a good way of communicating with public.
Yeah.
Okay.
All right. Yeah, thank you. Anyone else have a question? Yeah, I think we are almost time now. Yeah, that was a very good talk. I really enjoyed it. Thank you so much for your time. And on behalf of everyone, I'd like to thank. And yeah, and it's glad that you are a part of our seminar, speaker.
Okay, thank you very much. Thank you for having me. Have a great day.
Yeah, you
Bye.
too.
Thanks, Rozita.
Thank you. Bye.